COVID is, on a fairly widespread basis, causing infertility, sterility, and impotence. Yep, erectile dysfunction. Tell those men running around with the big guns, right? And if you want to have a baby, wear your mask. Be careful. Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. This is Lois Parsley has done just a really great deep dive research into the effects of COVID on people who don't die from it. Everything we're hearing, or most of what we're hearing in the media, is people who die of COVID. And yes, that's an outrage. You know, we've lost more people to COVID than we lost in World War II. I mean, it's like we have exceeded any measurement of an insane national emergency. We have 1 out of 5 COVID deaths on Earth is right here in the United States, and yet we are 4% of the world's population, which I think is what, 1 out of 20 or thereabouts. It's mind-boggling. And it turns out that it's the result of an intentional policy to spread COVID as far and wide as possible. Kristi Noem really did her part in South Dakota by having the Sturgis motorcycle rally, where 500,000 people came to South Dakota and then traveled all over the country. And boom, you've got mass infections all over the country. This was all a Republican plan. So let's look at the long-term effects. This is Lois Parsley's piece you can find over at Vox.com. It's titled Long-Term COVID-19 Effects, the Many Strange Symptoms Explained. She starts out with a story of Heather Elizabeth Brown. She was in her 30s. She was active, healthy. She said, but they had to coach me how to breathe after having COVID. 6 months later, Brown is still very ill. She's been hospitalized for blood clots and has lingering health. This is 6 months later. Has lingering heart problems, nerve pain, and extreme fatigue. Even making breakfast is now out of the question, she says. And she's also experiencing severe brain fog, so she can't work. Almost a year into the pandemic, writes Lois Parsley, there have not yet been thorough, long-scale studies to determine the true prevalence of long COVID, but preliminary research suggests that somewhere between 10 and 88% of COVID-19 patients will experience at least one symptom for months. Some of these can be life-altering. One study found that 50% of non-ICU patients reported a significant change in their cognitive functioning. In other words, how they think. Anthony Fauci, quote, "This is a phenomena that is really quite real and quite extensive," end quote. The sheer volume of people getting sick means there are already millions of Americans who have and will soon have long COVID. Now, what are some of these differences? Number one, both men and women have reported sexual and reproductive symptoms following COVID infection. This was a survey of 640 long-term COVID patients, reported more than 200 total symptoms, including testicular pain, urinary problems, and menstrual changes. COVID-like symptoms, quote, brain fog, fatigue, dizziness, joint pain. All of that is happening. They're saying these are the symptoms of menopause, but people are getting them in their 20s and 30s. Long COVID can also significantly impact male reproductive systems and testosterone levels. During acute illness, the testicles are attacked by the virus directly because they are one of the highest sites of ACE2 expression. This condition, quote, frequently presents in men with erectile dysfunction. They also found autoimmune orchitis, which is an inflammation of the testicles, which leaves you infertile afterwards. You can no longer have babies. It affects the arteries in the penis, making erections difficult or impossible. Erectile dysfunction is highly prevalent, particularly when you look at the groups who have had COVID from the study. By the way, something that you should tell all those guys with their guns running around without masks. One study found 81% of ventilated patients developed delirium. 1 in 5 patients experienced long-term cognitive impairment. 1 out of 5, they're long-term cognitively impaired. New research suggests that around half of asymptomatic, that is, people who have no symptoms, can have permanent damage to their lungs. Large blood clots cause tissue damage requiring amputation. Smaller clots can restrict blood flow in the lungs, impairing normal oxygen exchange. This is among people who are not hospitalized. If clots travel to the heart or brain, they can also cause strokes or heart attacks, as 23-year-old Riley Behrens recently suffered after corona infection. Before this, she said, "I was a healthy young athlete with no major medical conditions." A study published in the Annals of Vascular Surgery found a twofold increase during the pandemic in major amputations and a spike in the number of stroke patients. In half of 172 hospitalized coronavirus patients, the scientists found autoantibodies. These are when these are injected into lab mice, the animals develop blood clots. COVID-19 patients, half of 1,216 COVID-19 patients, again, not hospitalized, in one study also had heart abnormalities, and 1 in 7 had severe cardiac issues. People can present without any lung symptoms, just have heart and brain involvement, says Eric Topol, a professor at Scripps Institution.